What happens when you build a multi-million-dollar healthcare company from scratch, then sell it in your 30s? Paul Gallagher went from direct care worker to running 32 locations and 140 caregivers before cashing out to private equity. But what comes after the big payday? Paul opens up about the surprising challenges of post-exit life, from filling the void to chasing his next deal. He also breaks down 2 acquisition deals he pursued, the lessons, the red flags, and why structure often matters more than price. If you're buying, selling, or dreaming of your own exit, Paul's story will change how you think about deal making and what comes next.
In due diligence, before even getting to other aspects of due diligence like law or contracts, operational, a lot of it was structured around the financial, just way too much time spent on the financial aspect. But it was a lot of just uncertainty in the way they were explaining the add backs. There was a lot. I mean, it was something I've never seen before.
Yeah.
So I was a direct care worker working with people with intellectual and developmental disabilities since in 2008. So going way back, I was a home manager as well, got promoted throughout the industry, and was lucky enough with relationships I built and the care and passion I have for people with disabilities in my work to get awarded a contract. And that was in 2012. So 5 years into the industry, got contract at 23, built that up to about 140 caregivers, 32 different locations. It's not necessarily licensed group homes, could be compared to that, but a little bit different. But sold that in 2022. And from there,
What was the revenue when you exited?
It was, going way back. It was approximately, I have to look, it was like 5.5, 6 million.
Okay.
Yeah.
Got it.
Something along those lines. At the same time, after lost the train of thought. So after exiting, that's a big deal too. So after exiting, it's not just like, oh, I'm gonna go retire now, I'm gonna go do whatnot. It was a huge learning curve for me. And I'm still kind of learning from that, by the way. There's a huge, I think, niche in being able to talk to post-acquisition or post-exit entrepreneurs or founders. So I pivoted into home services, but I think I'm getting called right back into home healthcare, in the home healthcare space.
Okay. So tell us a little bit about that experience, the post-exit experience. So when you sold, did you have to stay with the business?
No, it was like 30 days, but no.
Oh,
okay.
I
had a great team.
Oh, nice. So you built your business in a way that didn't really need you to be in it. So was the acquirer a private equity or like an independent?
More small private equity. But it's kind of a mix between small private equity and independent. It's interesting dynamic.
Okay, got it. And so you exited, you're 30 days, you're done, then what happened? What made that post-exit experience kind of interesting to navigate for you?
Yeah, the post-exit. At first, it was like, okay, now after selling, it was leveraged buyout, so it was 100%. It was like after maybe assisting here or there for a few days, it was like, what do I do now?
Yeah.
And instead of listening to, say, a therapist or listening to a friend, and a lot of people say, take like 6 months off at least, don't do anything.
Yeah.
I started trying to figure out what was the next thing. Instead of focusing on family, I started trying to figure out what to do next. And I became a little more risky and getting in, I'll do this or do this without actually just taking a pause, focusing on my family. And it's like losing a kid in a way.
Yeah.
And so that's all I've known since I was 18 years old. And now it's no longer there. And now what do I do?
So you try to fill a hole.
Yeah, exactly. And having a little bit of money, whatever. But at times I felt, looking back now, I'm probably more fulfilled just working in the business and running things than having some some money in the bank.
Yeah.
So I've learned how I'm wired more as well, and how I'm more fulfilled as well.
Yeah, that makes sense. So tell us a little bit about these 2 deals so when you started searching, you start looking for something similar to what you've done before, because that's what you know.
Yeah.
So what was your buy box?
So at first it was, well, it's kind of changed. But the buy box was anywhere from $400,000 EBITDA to 1.5 million.
Okay.
Michigan, Ohio, Florida. Because of my non-compete, I wouldn't do the IDD business or senior care for a few years or whatnot. I could do senior care now in Michigan, but it's Ohio. Kind of like the Midwest, Southeast was a focus.
Okay.
But then even within that, my eyes perked up or ears perked up when Ohio, Florida, Michigan, and things like that.
Okay.
It was healthcare industry. Now with that, obviously, is very broad. So home healthcare, it could be ABA services, home healthcare with seniors, private duty, medical, well, DME, which is durable medical equipment, transportation, kind of all encompassing the healthcare industry.
Okay. Makes sense. And so were you searching on your own, or you had someone looking for you? You were working with some service provider, or just doing it on your own?
I had a service provider once or twice. It was just epic failure, I would say.
Okay.
The way that it all transpired. So I just searched on my own, and that's what I did a lot. A lot of my week was I had KPIs lined up, and we said, okay, well, I said I will reach out doing online, and then I'll do some calls. I didn't push the calls as much as I should have, but so off market deals, but a lot of the on market deals, the various websites I was able to find, and that's what brought me to the first deal. It was a very unique deal. I actually said no to it. I actually worked with this group prior on some other deals. With this particular deal, I said no to it at first because it actually had a negative net income. But the way that the business was ran, it was unique. And I seen like the actual profit centers, and it was actually advertised as 1.5 million EBITDA.
Okay. So what was the revenue on that business?
7.7 million ish.
Okay, so
It was actually 8 million. It was 8 million advertised, but as we got at that time, it actually gone down in revenue a little bit since then.
Okay, and then he said 1.5 million EBITDA.
Yeah.
Okay, and so you saw it at first. It had a negative net income, and then you went back and it actually have 1.5. So what was making it negative? Was it just a lot of ad backs?
That's exactly what it was. He had a very high salary, has family on the payroll, and then he had a lot of ad backs, expenses going through the company.
Okay, so a lot of ad backs, and
yep.
so how did you find out the real number? Did you actually do a quality of earnings report, or did you go do a financial due diligence to get to that number?
Yeah, so when I first said no to the broker,
yeah,
it caught my eye because it was all 1.1.5. It had the revenue, it had the exact business. It was in Florida. It was just everything that I'm like, oh, Perfect. This is great. And then he sent me the information over. I'm like, negative? No, I'm just not gonna. I'm gonna say no to it.
Yeah.
But then he said, well, Paul, why is that? Actually, there's a lot of ad backs. Here's more information. And so I said, okay, I'll take a look at it because I have a relationship with him. And looked at it. So, okay, here's all the ad backs. Got my CPA involved to do a financial due diligence, kind of a partial due diligence in that way.
Okay.
And I said, okay, it's worth pursuing from there.
Okay.
That's what brings me to one of, I took some notes in the sense of what I wanted to share.
Yeah.
Is just don't get so emotionally tied to the business beforehand.
Yeah.
Because as someone who is going to acquire, the group that's watching this to acquire, it's really easy to get emotionally tied to a deal. And so not only at first was there like, oh, this may be great. It was an emotional response then, but diving deeper into the deal and actually getting close to the owner, there was more of an emotional attachment when I realized now should just walk from day one. So no, should have went with my gut. So
yeah. So talking to the owner made you more attached to the business.
Yeah. because
Okay.
he really was attached. I'm good at talking to owners, and I think he really liked me compared to other people he have spoken to as well.
Okay. And so did you make them an offer before doing that pre-due diligence, or you had, or you just did that before you write an offer?
I met with him before making the offer because I felt like if there was other offers on board,
Yeah.
oh, I like Paul. Maybe it's a little bit less, maybe it's this, but you know what? I like that guy, and so I felt
Got
like
it.
that would be the best approach.
So what was the offer that you gave him?
It was 7.75. It was a little
Ah,
bit. It was a little bit higher.
so like almost 5x,
5.2.
5.2x.
But we were getting. That's where another key point is structure is greater than price.
Yeah.
And in this, we were able to structure it where he was seller financing like 80%. It was something outrageous.
Okay.
Because of all the ad backs. So if you're looking to sell a business,
Yeah.
you want to have some people consult you because you want to have clean books for 2 years, in the sense there's not a lot of ad backs, not a lot of personal expenses running through the business.
Yeah.
He had so many, and some I would just say dubious or controversial, where it wouldn't be SBA involved.
Sure.
And some banks maybe wouldn't be very careful of wanting to lend on it. And I found that early on. And I knew that early on. That's why I said no and had a long talk with a broker, but we talked through some things. And so that's what led to the really high. I think the deal ended up being, I come to the table, cash at closing 1.5 million of cash, and then the rest is seller financed. So whatever that percentage is.
Okay. Okay. So about like 6 million and then the rest. Okay. And so the structure was attractive. Was the seller financing amortized over 5-year, 10-year?
It was kind of a straight amount of like 200,000 per year, or excuse me, like 750 or $800,000 per year, just straight amount.
Okay.
Over X
Okay.
amount, and it was probably
A little bit less than 10
5
years.
years, and then
Yeah.
we would have just got a loan for the next 2 or whatnot.
Got it. Okay, that makes sense. So you're, so like 5 years, and then there's a balloon that you would amortize. You get another you refinance out of it.
Yep.
And so now you put an offer out. It's strong seller financing, and then what happened?
So now we're under contract, and we start doing our due diligence, and and in due diligence, there was a lot before even getting to other aspects of due diligence, like law or contracts, other operational. It was a lot of it was structured around the financial. Just way too much time spent on the financial aspect. It should have not been so tricky.
Why was it like your quality of earning people or your CPA did not get enough information back? Were they not responding with the answers to questions?
Yeah, it was a mixture of, I don't know how the things started changing a little bit. Revenue started going down a little bit. I know that he was kind of going on more vacation, so that was a kind of a scenario where maybe it was more tied to him. Because when I visited him in Florida, his team is fantastic. I actually had a little huddle with them when we were talking, and they were excited.
Nice.
But it was a lot of just uncertainty in the way they were explaining the ad backs. There was a lot. I mean, it was something I've never seen before.
Yeah.
So CPA had questions. I had questions. And we wanted it all cleared out before we did a quality of earnings.
Yeah. Oh, okay.
So he did like a financial due diligence, but to go like full blown, we wanted a lot of the aspect to be done, and then take that to like the next level of, okay, then finalize.
Well, why would you do that? Because now you're going to end up doing double the work, because you do part of it, and then another person comes in and does the quality of earnings.
What was his partner?
Okay. So it's the same team.
Yeah. So it would have been a situation where we needed to get to grasp, I guess, the accounting.
Yeah, but I mean, a quality of earnings person is going to ask for, access to the general ledger for the last 3 years, 4 years. They're going to ask for bank account statements. They're going to reconcile those books, and then they'll pull what's the add back and what's not, and then they're going to verify it with the with the transaction in the bank account and all and so forth. So usually, like, quality earnings is enough because you're gonna get access to everything all at once.
Yeah.
I think when you start asking the seller, they kind of start getting like annoyed and twitchy and get pissed off about things, especially if they think that you like them and you trust them and you already kind of met the team. And then like, well, you told me you like me, and then now you're like questioning. You told me you trust me, and then now you're asking all these questions. It kind of feels so. So how long did that process take?
Months.
Like how many months?
3 maybe.
Okay, yeah, it's too
It
long.
was out of town, just various things.
Okay.
Then there was questions that came up that took a minute, and then took a minute. Revenue slightly down, had to be explained.
Okay.
Then they had come out with a for me, it wasn't even to my CPA. I had some questions that didn't even need to go to the CPA.
Okay.
Where I'm like, well, this add back now creates this evaluation, or that you're missing 100,000 here or whatnot. What's this? And so it almost seemed like they're apprehensive to share like absolutely everything, which was a red flag.
Okay.
And then he started wanting changing the terms. So towards the end, it became, well, he wanted to only sell our finance 50%, and all of these things. I had to come to the table with 2.2 million, or it was just one thing after another when I actually had everything locked in. And so another lesson was make sure before they wanted a purchase agreement. Like, well, we have to get the LOI. So I thought we had the LOI taken care of, and it was signed. And so the 1.5 million at cash at closing. So I said, okay, we can go. I probably didn't have all the terms as clear as they should have been. It could have been on me. I could have been on the broker. There's a lot of aspects to it.
What terms were missing in your LOI?
That's what I'm trying to review right now, going back and looking at. I think everything was there. I think, you know what it was? It was the owner of the business maybe not being 100% sold on selling, but if he was questioning. It was his whole learning process, and he was questioning himself along the way. Because one minute he would agree to something, and the next minute the next day I hear it was something totally different.
Okay.
So he was a really hard seller to work with, and I don't mind sharing this. The broker even said, because of the deal in itself and how hard it is to work with that particular seller, that they probably are not going to relist the deal with them anymore.
Oh, wow. Okay.
So that's kind of the experience. So it was like, hey, Paul, oh yeah. If I'm buying from you, Jay, or selling to you, Jay, oh yeah, Jay, I can do that. Oh yeah, you want that term, or okay, we can do that. And then if it was just you and I having a conversation or whatnot, then it changed. Or even if the broker was involved in that conversation, then the next day he would change his mind.
Yeah.
So what I learned is to it's a proposal. Get back to me tomorrow or in a few days once you have time to think about it.
Yeah. No, it is so true. I've seen that. I've had experience with sellers just like that, where we'll sit for 2 hours, have a great conversation, have a meal, and then we feel like we're all in agreement on what we just talked about, and then we send out term sheets or LOI or whatever, and then it'll take 2 weeks for them to respond, and then they come back with something completely new from what we just talked about. And then they'll say, oh, I have some other person, So at the minute you start noticing that, I think that's not a real seller. You just move on, because and the minute they start delaying, the minute they start coming back with new terms, when you've talked about the terms already, then immediately you just call it a day, even though the business may be really attractive. And in my case, I had the same thing. It was a very attractive business, and we spent 3 months with the seller and didn't go anywhere. So I totally empathize with that experience. So that ended, or are you still talking to him?
No.
Okay.
It's pretty much ended.
Okay. And then that was the other one. Tell me about the other deal.
So it's another IDD business in Florida.
So IDD. So explain IDD.
It's intellectual and developmental disabilities.
Okay, got it.
Yeah. So that's another east coast of Florida. We're still in. It hasn't fallen through in that sense. So we had under contract. We actually were going to partner. There was a lot of different. We got to know each other. His name. Well, no, his name. So
let's start first. So you found this business. Where did you find this business?
that actually happened to be online as well.
Okay. And is it Biz by Sell or BizQuest or one of those websites?
BizQuest.
Okay.
Yeah.
Okay. And then what was the revenue, and then what was advertised as revenue and EBITDA?
$3.5 million revenue. What was it? 750,000 EBITDA.
Okay. And how much did they want for it?
They wanted 3.75 or something like that, but
Wow.
we end up negotiating the 3.1.
Okay. Also on the high side. Okay. And then were the terms of that also like heavy seller financing?
So yeah, some of it was actually 20%. But after building a relationship with him, we found out it could be really good actually to partner.
Okay.
So I was going to buy 60% or whatever, 70% or whatnot. And he was all gung ho about it. Even with the SBA rule changes, the bank was ready to go.
He was willing to sign the guarantee on the loan, the personal guarantee on the loan. Okay. Wow. That's good.
Okay. So in this case, I didn't have to come out of pocket with any money
Okay.
because it was seller financed. He's staying in the deal. It was seller financed, and he had a what do you call it? Additional like 10% that he was what do you call that, Jay? Why am I going blank? Not only seller, there was two seller finances. One was like 10%.
Oh, okay.
Another was 5%. So
okay.
One was on standby for the life of the loan.
Sure.
And the other was paid after like 2 years.
Okay.
Standby for 2 years.
So that's 15%. That's 15% seller financing. And then he was rolling equity as well. He was going to keep equity. How much equity?
I think it was 40%.
So he was putting 15% seller financing and 40% rolling his 40% equity?
It was 15% seller financing and 40% equity.
Okay. And then so you were going to own 60%. And then you were only going to finance about 35%.
Yeah.
Wow. Okay. So zero down deal.
Yeah.
Okay. And then he signed. Then what happened? He signed the LOI. Then what happened?
So there's something called EVV in the industry, electronic visit verification. So if anybody in the industry, it's like, hey Jay, you're a caregiver. You're working for me, taking care of me, and you were supposed to show up at say 8 a.m. to 4 p.m. every day. Well, how do you know that? How do you know the caregiver's coming in at 8 a.m. and leaving at 4 like they're supposed to?
Yeah.
So it's very easy what they say Medicaid fraud. If you say, oh, I came in at 9:30, I clock in at 8, and so what that does is on your phone, it's a system that Florida would use, for instance, and they would log in to start their shift, just like clocking in, and it's GPS or whatnot, shows that you're at their house, and then you clock out at the same time, and then there you go. What happened is, I think part of the business, some of the customers or whatnot was not compliant with that. A lot of it is, so it's still mixed up, but there's a lot of money that's not paid out right now, and he's using his own funds to pay.
So Medicare is not paying him back. It's not reimbursing because the people have not clocked in correctly, have not clocked out correctly. Is that the case? So they're holding back the reimbursements.
Yep.
And then so he was paying out of pocket his people, but he was not collecting. So he had like a big receivable. How much receivable did he have?
Over $500,000.
Okay.
It was still doable, but there's some revenue is down sharply, so we're still trying to learn. So I think it's going to delay the deal a few.
Got it.
3 months.
So how long does it take them to get paid typically?
So understanding Medicaid in Florida, it could be a few weeks to like a month, the way that the billing cycles are, even 3 weeks. But this is
so on average, just say max 30 days.
Yeah.
And if he's doing 3 million, that means he's doing $300K a month. Right?
Yeah. Well, it's more. So he gets paid. He's gotten paid by other contracts that he does have.
Okay.
I don't think I understand the story entirely, and so I'm just kind of, we'll see what happens.
Okay.
But yeah, there's the revenue was down more than $500,000 though. So there could be.
Well, no, that's one thing. So the 500K is one thing, but the revenue is a different thing. So how much? So did you do last year? 3.1. You said
3.5.
3.5, and then this year is on track to do what?
I think like 2.
Oh, that's large.
Something is little, and it's like that doesn't even make sense.
Okay.
A little bit. So we're trying, the banker is trying to diving into it with them.
How many people does he have? The practitioners. How many practitioners does he have?
80. Around like 80. 80. Is it 75 or 80 caregivers?
And these are full time. These are full time.
Most of them are full time.
Okay, and typically in the industry, how much revenue per head, if you will, per caregiver, you would typically expect?
So the difference is, it depends, because it actually depends on reimbursement of the services that you're providing, and how many hours of that service. Like if they're at home, or if they live with a roommate, you take care of 2 people, technically the rate's actually higher. Reimbursement in Florida, the way I understand it, is approximately on average like $25 per hour, and you're paying your caregiver 16 or whatnot. I don't know all the numbers like that right now, but that's typical.
So if you think about $25 an hour, people work for what, 2,000 hours a year?
Yeah, 2,000.
So that person's going to be making what, about 50K?
Yeah,
and generating about 50K. And so you have 80 of them, so 50 times 80, that
4 million
should be about 4 million.
Yeah.
So you're doing 3.5, makes sense, it's close.
Yeah, he should have. They said they should have actually hit 4 million, but so some of that 500,000 was actually revenue from last year that wasn't even accounted for, and the business actually made like 890, 870, and 2020 numbers.
Okay, so this year, do they still have the same number of practitioners?
Yeah.
How many? Same number.
Yeah, so they haven't lost
still
any
full-time.
clients. Yeah, they haven't lost any clients. They haven't lost any of their caregivers. So it's
kind
of mind-boggling what's really going on.
Got it. Okay. Okay. So if there's the same number of practitioners and they're still full-time, therefore that revenue shouldn't drop that much. It should still be in that 4 million, 3.5 to 4 million revenue range, because of that many because that business just grows with practitioners. The more practitioners you have, the more revenue you're going to make. And, and if they haven't churned half of their people, then they shouldn't lose the revenue. So
exactly.
So are they not booking revenue until they actually get reimbursed?
I think it's I don't think it's cash basis. I think it's accrual. But regardless of that, yeah, you're right. If you have 500,000 that's not being billed for, or delay or billed that is waiting to be approved because he's going through a process, he is going to end up getting it.
Yeah.
Then your revenue should be on track minus the 500K for the year to date. But again, it's more complicated because some of that 500,000 of revenue is actually half of it's for like 2024.
Right.
And so the revenue is not even could have been higher by 250,000, and some of the income could have been even higher than the 870 or whatnot. So it's very
interesting.
It
is. Yeah. And I mean, I think so. So have you done quality of earnings? Did you go through that process or no?
We almost did until this hit. We were actually getting ready to, and then having a closing date too, just because I kind of already looked at all of myself. So I still would hire quality of earnings, but at the same time, I'm really good in the IDD space, and I can look at it, see all the information, and go, okay, that makes sense. Here's what I will hire quality of earnings to verify, because quality of earnings could go with the financial aspect. What's the word they use? But there's also a clinical aspect.
Yeah.
And so doing the timesheets, making sure everything matches up So you got audited. They're going to say, we need this caregiver for this period of time that worked with this gentleman or young lady, and match all those things up.
Is there a lot of coding in the billing part, or is just one or two codes? That's it.
Depends on the services. A lot of times you might only you double down on 2 or 3 services, and it's that
Okay. That's it.
they call CPT code. But
Okay.
yeah, and sometimes it's direct data entry. I know in Michigan when I had mine, it's all already on there. Kind of, you just got to input, and the code you only use like 3 or 4 different codes.
Okay, so it's simple.
Yeah.
And there's not much. There's no room for shenanigans in that coding piece. So the only thing is the clocking in, clocking out. You have to have like really clean records on
and documentation.
Okay.
And so you just make a note for that shift. Did this, and whatnot.
Okay, got it.
And yeah, there's no shenanigans at all with Medicaid. Put it that way.
Okay, yeah, it makes sense. So that keeps it simple. So now just are you still in the deal or you're out of the deal?
Still in the deal. I'm just waiting to see what happens in a few months. So it's kind of on standby. In the meantime, it's looking at deals. And what's unique is that I'm not just looking to buy. I have some opportunity to also partner right away with some avenues, or actually build. I'm certified. We talked about that a little bit.
Yeah.
Doing private pay or whatnot. So I can even start from the ground up, but still keep in mind the acquisition piece.
Yeah. So what is the ideal looking operation? So what is the ideal looking operation in that space, in the mental health space or disability, or you call it
intellectual
development and disability? Okay. Intellectual development and disability. So what is the ideal business in that space? So what would the revenue look like? What is the number of people look like? What is the structure of the business look like? And what does the margin look like?
That's very interesting because it pertains to what state. So
yeah, so let's say Florida, for example. So
okay, Florida,
everybody wants to be in Florida. So Florida, what is the ideal size revenue for you?
That's a good question. That'd be at least 3 million, 2.5 million, 3 million and up.
Okay, so but
that's
no,
but smaller side, bigger side, 7, 8 million.
Okay, between 3 and 8 million.
That's fair.
Okay, and then so that company will have so gross margin. What is so their all their cost of goods is labor, right?
Yes, probably gross margin. So gross margin 25 to 30, but net profit probably 10 to 15 is healthy.
Okay, so the 25 to 30 gross margin, 10 to 15 is net margin.
Yeah, and that's IDD but in other areas like durable medical equipment, margins are different. But
but let's just stay in IDD. Yeah, if we stay in IDD, so in IDD we get a business, let's just say that's like doing 5 million. Their gross margin is going to be about 25-30%. Their net's going to be about 10-15%. And their overhead is just administrative work. They're not spending any money on marketing, are they? There's not a lot of acquisition costs. Most of the clients come straight from Medicare.
Yeah.
Okay.
Yeah, referral sources, and then you build a brand by providing good care and referral sources. But
okay. You don't have like a sales team. Do you have a sales team? No. It's mostly your team is all admin.
Correct.
Okay. And that admin cost is going to be around 10-15%.
Yeah.
Okay. And any other costs in the business aside from labor and admin?
If you provide vehicle transportation, it can be K-Packs for that.
Okay.
I'll try to make it simple as possible.
Simple as possible. Okay. Got it. So that 500K will net about 5 million will net about 500K, and then you would be paying a typical would be how much purchase price? How much would the purchase price be on that?
I would just say, it was 3 to 5x. I've had some brokers tell me some deals that are million EBITDA above are like 6 or 7. I'm just like, well.
So, but I heard the formula. I heard the formula for like revenue times 1.2, the revenue times 1.25. Is that something that exists in that space, or is just based on? It's not based on revenue. It's based on EBITDA and then it's like, typical 3 to 5x.
Yeah, it's more so, I wouldn't say it's revenue based as much as it is profit based, because there's some businesses that have healthier margins than others, ran really well. So I've seen businesses in this industry that say 5 million in revenue, that is under 10%, and there's no way in heck I would buy it at 5 million.
And so the practitioner, so 5 million revenue operation has probably about 100 practitioners, and
what revenue?
5 million revenue, it has probably about 100 practitioners. Do you have a layer of management to manage those people, to coordinate and all that?
That's what you would need. And so
that's the admin staff. Got it. And how much admin staff do you need per practitioner? Or how many practitioners per one admin staff?
So if you have a involved owner running it, that's one. You can have kind of an HR person, maybe an assistant, and then you definitely want some compliance. So people that get in, the documentation comes in, you got to make sure that's all good and make sure there's quality of care is being and scheduling. So it could be like 6-ish.
So an HR person, and an assistant, and then a compliance team, maybe 1 or 2 people, and then what's the other 2 people? Counting?
I would say operational, like overall, making sure that, because you might also have regional managers.
Okay.
So I'll just use
who's dispatching people? Like, is there a person that's the operation person that dispatches people? Who goes where?
Yes, and in group home settings, it would be the home manager that does the scheduling.
Yeah. No, but in this case, it's not a group home. It's the IDD.
So that's exactly. So just to kind of give some framework on that, with IDD, it is like so there's services where maybe they live at home with mom and dad, or they live in their own home. They might get, say, 40 hours a week, 10 hours a week, 20 hours a week. But in a lot of cases too, they have roommates. And the company I sold and the companies I looked at, they had a mix between the caregiver going into that home, or 2 or 3 people live together and get around the clock care.
Oh, okay.
Yeah.
Got it. Okay. That's interesting. Okay. So I understand that business now. So, and are you seeing a lot more 5s than 3Xs, or what are you seeing out there?
To be honest with you, it depends on the broker from the firm.
Oh, every broker is different.
Some is insane.
Okay.
I can tell you it probably should be around 3.5.
Okay.
Maybe 4 on the higher side. Am I willing to overpay if the structure is correct? Again, if the structure is correct. Hey, I'll buy a business that's worth $1 for $1 million. If I can pay it back over 2 million years,
Okay. You mean you're talking about deal structure? Okay.
Yeah. So it all depends on the deal structure, culture of the business. That's one thing too. If I get a good feel of culture, I can see that through talking to the owner and just various things, even before talking to any admin that I'm able to.
Yeah.
It could be a really high profitable business, but not good culture. I won't buy it.
Okay. What is a sign of a bad culture?
Turnover is one. Looking
at turnover in the practitioner level or at the admin staff level?
The admin staff level.
Okay. Got it.
There's a lot of turnover in general. So it's also knowing in the industry, industry standards of turnover. But you can say and also how long the administrative staff have been there.
Okay.
And sometimes how the owner perceives, believe it or not, I've talked to an owner and the way that they perceive the caregivers or certain things or the way they talked, I can just tell it probably funneled down in a negative way to the company as a whole.
Makes sense.
But reviews online, look on the website, interactions. There's a lot of things you could probably uncover.
Yeah. And I mean, I totally agree. I do the same thing. In any service, you could, read through the reviews. You could tell, based on what people are complaining about, you can tell what kind of organization this is and then what kind of management it is. If you observe enough, you will start noticing these things. Yeah. Okay, that makes a lot of sense. And is there like a private equity presence in the space, or are there like private equity companies buying these?
Yes, it is an extremely fragmented industry. A lot of mom and pop shops.
Okay.
I forgot it starts with an S or something, Stevia, something. It was like an $835 million deal.
Wow.
Might have been earlier this year or last year.
Okay.
Yeah, there's PEs and behavioral health now.
Nice. Okay. And your goal is to buy something, grow it, and hold, or buy more, and then exit?
Buy, grow, buy some more, hold, and then eventually exit.
Okay.
Yeah.
Okay.
I love the industry. I love
Yeah.
people. So yeah, that's the goal.
Got it. Okay. Well, I appreciate you running us through these two deals. That's very fascinating. Take the same patterns as most the deals that fall apart. Anyway, it takes, the seller is not sharing all the information, or revenue goes down, or time lapse takes too long, and then things change. So pretty much very typical uh, reasons for a deal to fall apart.
So I have two things that actually the two
Yeah.
golden rules, I guess, if you will.
Yeah. Go ahead. Yeah.
So every deal that has fallen through for me, it sharpens sharpens me for the next one, that one that doesn't. So that's been something that's been huge.
Yeah.
We talked about emotional attachment. There's like a lot of notes I've taken for learning and reciting this.
Yeah.
Another one is realizing this: red flags, they're not going to shrink post close. Like it's going to magnify. So that's something that I kept in mind with some of these deals, is like there's some red flags and what happens post close. So those are a couple of insight that I've learned too.
That's awesome. Cool. Well, I appreciate it, Paul. Thank you for sharing your experience.
Thank you.